what you're saying is there was a significant fall in the amount of work porters had to do.
Definitely.
Yes. Mr. Craig, could you give your full name to the inquiry?
Neil Thompson Craig.
Yes. And you have worked as a porter at Glasgow Royal Infirmary for 25 years, is that right?
That's right.
That's right. And you're also a union representative for Unite.
That's right.
Yes, that's right. Well, your statement then turns to the impact of the pandemic on shift patterns, so work shift patterns, and we just wind the clock back a little bit to the outbreak and the beginning of the first lockdown. So you begin in paragraph 28 by describing the pre-pandemic situation, that certainly in your case you would work about 48 hours per week, albeit some of that was about 10 hours or so of that was overtime.
Aye.
That was the routine position. And you say that, interestingly, that as you remember it, at first your colleagues as porters were not getting COVID or not catching it.
No, I know at first, because when at the start, a lot of reporters, because we were essential workers, we were going to work. we were lots of people were going to work. Obviously, you're reading media, and it was like it was well done. You're going to work. This is your duty. So a lot of reporters were going to the working, and the managers didn't know the impact of COVID at first. How capacity in patients that was going to be. So they thought the workload was going to be higher.
Yes.
So we were all there, and we could be there as long as we wanted to be, really, because people weren't unsure if you were going to be needed. But it turned out we weren't really needed.
So people were coming to work. They weren't getting COVID at the beginning, and the shift patterns at first stayed the same. But what you're saying is there was a significant fall in the amount of work porters had to do.
Definitely.
Yes.
We didn't have the capacity in the hospital. A lot of patients, obviously, they discharged out of the hospital, either at home or care homes or other places. They didn't do theatres, they didn't do scheduled elective surgeries or anything like that. So, the workload was definitely not as bad.
And that's partly because you explain in paragraph 30 that the medical block was less than half full. But by the medical block, you mean we're preparing for theatre, or?
No, medical block would be like your everyday general medicine patients. So
right. So that
we were used to the wards being full of capacity most days, but then you'd go into the wards and they were like half empty, half full, whatever you might look at.
And so people, in paragraph 31, you see people were still coming to work, but a long period could pass before a porter was asked to do a job. Yeah.
Because of the amount of workload wasn't the same, and because we had that was the best time we were well staffed in the hospital, because people felt it was their duty to go to their work and work through it, and we had lots of free downtime.
But then, from sometime in April 2020, admissions to hospital of COVID patients increased.
Aye.
And did that mean the workload increased for porters?
So gradually the workload would increase, but it would still
or return to normal.
It still wouldn't be anywhere near as a normal day, because you've not got elective surgeries on, you've not got clinic appointments, so you've only got people that seriously need to be in the hospital in emergency theatres.